My innovative idea is a Stick 360 surgical 3-ply mask. Masks have been proven to be one of the main personal protective equipment, and they play a dual role to prevent the spread as well as protect the wearer during this COVID pandemic. Commonly, we all use the cloth masks, but however, the cloth masks offer only marginal respiratory protection. But why are surgical masks not as effective as the respirators? This is because the surgical masks are loose-fitting and hence lack face seal fit. This study, published in the Journal of Occupational and Environmental Hygiene, assessed the total inward leakage of the N95 respirators and the surgical mask. What they found in their study was the face seal leakage is a major pathway that contributes to the total inward leakage of particles. The number of particles penetrating through the face seal leakage pathway of the respirators and the surgical mask was shown to far exceed the number of particles passing through the filter medium. Hence, face seal leakage is a major pathway for aerosol transport inside the filtering device. The surgical masks are not designed to provide a good fitting on human face that allows more aerosol leakage. However, some of the surgical masks were found to be as effective as the N95 respirators against aerosol particles similar to the size of infectious aerosols. So what this means? It means to be effective in reducing the wearer's exposure to airborne substances, a respiratory protection needs to have a sufficient fit as well as high filtration efficiency. So, the fit of the mask is as important as the filter. If you look at this chart, we are all trying to get into the blue zone. So, how do you get into the blue zone is by increasing the efficacy of the mask as well as the adherence. If you have a mask which is 70% efficient and is used by 70% of the population, we can still get into the blue zone. How to improve the efficacy of the surgical mask? My design solution is a skin-friendly, peel before use adhesive that can be incorporated on the backside of the surgical mask on all four sides. So why should one improve the fit? Apart from the protection, we are underestimating the effectiveness of the mask for source control. Nearly all of what is being emitted is droplets. Many of these droplets will evaporate and then turn into aerosolized particles. Wearing a mask as source control will largely stop this process. So what are the advantages of the Stick 360 mask? By having a face seal all around, both the inspiratory and the expiratory air has to pass through the filter material. It will reduce the droplet and aerosol leak from around the edges of the mask. At the population level, it would protect the wearer and reduce the spread of COVID-19. It would also improve the correct mask wearing etiquette. Healthcare setting, there would be increased protection for healthcare professionals and patients. This would be easy to use, suitable for all, and there is no need for any complex fit test. It is affordable for low-resource healthcare setting. This could substantially reduce the death toll and economic impact while the cost of the intervention. For wider application, we can use it among the healthcare workers during this COVID, and beyond COVID, this design will help in reducing the surgical site infections during the surgeries. It can be used for patients visiting the healthcare facilities and for vulnerable populations. This design is evidence-based, cost-effective, and probably as effective as a respirator for all practical purposes. STIX 360 surgical mask is a simple, doable, scalable, economically viable with global impact to overcome the shortage of respirators while containing the spread of COVID-19. Thank you very much.